Module 1, Data Collection, part of the Data Support Package to the Leave No One Behind partnership. Hello, and welcome to this training course produced by Development Initiatives as part of the Data Support Package to the Leave No One Behind partnership. Now, following consultations with the Leave No One Behind country coalitions, we at Development Initiatives have identified several different data-related knowledge and skills gaps that have been common across multiple coalitions. As a result, we pulled all those different ideas and issues and challenges together and compiled them into this training course. This course then provides standardized training and resources that will enable cross-country peer exchange and learning between the different country coalitions who receive this same material, and also to facilitate the transfer of standardized data onto the Tracking Progress platform that's been developed by our partners at IISD. But critically, the objective of this course is that you, the course participants from Leave No One Behind country coalitions, gain an improved knowledge on data-related issues that critically you can then apply in your own context. And this will strengthen the quality of the community-generated data that you're collecting, that you're managing, and that you're using. So looking across the whole of the data lifecycle. Now, critically, when it comes to what we mean by strengthening quality, we have identified three distinct areas of quality. So firstly, for us, quality, again, across the whole of the data lifecycle, is about looking out for respondents' welfare. That means empowering and promoting the interests of the people you're collecting data from and protecting them from harm. So that's a cross-cutting theme that will run throughout the whole of this training course. And whenever you see text highlighted in bold, in red, this is a reminder that this is the quality aspect that we're focusing on at that particular point. Secondly, robustness. This is perhaps what we more traditionally think of when we think of data quality. It's about the validity and the reliability of data, the degree to which technical standards and processes have been followed so that there's statistical accuracy behind your data. Whenever you see text that's highlighted in this blue colour throughout the training course, here we're referring to particularly this robustness aspect of quality. The third element of quality is impact. So this data and evidence that you're collecting, that you're managing and you're using will only be of good quality if it's useful, if it reaches the people that you're intending it to reach and conveys the message that you're intending it to convey. So wherever you see text highlighted in this green colour throughout the training course, this is where we'll be referring to the aspect of impact when we're thinking about the quality of your data that you're collecting, managing and using. Now, I've mentioned the phrase data lifecycle a few times already, but this is just to illustrate that data doesn't just suddenly come into existence. We have to think about what we want to collect, go out and collect it, process and store that data, publish that data, and then decide what we're going to do at the end of the process, how we're going to keep it, and when we're going to destroy it. This training course is broken down into three separate modules that are going to address quality issues in various stages of this data lifecycle. So Module 1 is going to cover aspects of data preparation and data collection. Module 2 covers data processing, management and storage, as well as what you do at the end in terms of retention and destruction. And finally, Module 3 focuses on the analysis, communication and use of that data that you have successfully collected, processed, managed and stored and brought to your audiences. So throughout this training course, we're going to be presenting lots of ideas and concepts and tools and recommended approaches. To help this come alive and to illustrate what this might mean for you in practice, we're going to use an example, a fictitious example, that runs throughout the whole of this training course. So let me give you the scenario that we're going to be working through on this training course. An organisation of persons with learning disabilities in Deviland is concerned about the care that persons with learning disabilities receive in their local healthcare facilities. Now they've asked you, so you are the data collection team and data management and dissemination team that will help them to collect high quality data that is reliable and provides verifiable evidence of what persons with learning disabilities experiences are of those healthcare facilities. The purpose: this data will be shared with international funders to influence funding decisions and with the domestic Ministry of Health in Deviland to mobilise government action to address the issues of this group. So bear this example in mind as we run throughout this training course, and that's how we'll be applying some of the more theoretical and conceptual things that we'll be presenting. And what we'll be presenting, this is the contents for this module. First of all, we're going to talk about the rationale for new data collection, why you might want to do it in the first place. Then we'll talk to the legal and regulatory context that you're working within. We'll talk through research ethics, design, sampling, and finally get you out into the field to do the actual collection. So here, as you can see, there is a lot more on the preparation side of data collection than there is in the actual physical going out into the field and getting your hands on that data. So let's get started. First of all, the rationale for new data collection. Probably the most important question you need to ask throughout this whole process is, do you even need to collect new data in the first place? To answer that question, you need to have a clear idea about what your research aim is. What are you trying to find out? About what? For who? What is the purpose of this data being collected? There are many reasons why you should stop there and say, no, I don't need to go out and collect new data. Firstly, it may be that once you've identified your research aim and been clear on what your research questions are, you've found that there's really good data already existing that's not been used to its full extent. So draw on existing data wherever you can, because all data collection carries with it risk. There can be risk to already vulnerable, excluded and marginalised people, the people you're trying to collect data from. It may put them in harm's way by being a part of this research process. So there's a cost involved over and above just the financial cost of conducting this survey and collecting this data in the first place. Finally, it may be that when you think about your purpose and you think about the audience for this data, your audience may not value the kind of data that you're planning to collect. So there may be very little point because it's unlikely to have the impact that you would like to see it have. You may then need to think about doing some more work in the background to create a better enabling environment for that data to have impact before you go ahead and invest in the data collection itself. But there are also many really good reasons why you would want to go out and collect some new data on people that are particularly excluded and marginalised. And when you do that, throughout the whole data life cycle, from the preparation, collection, storage and use, we're going to be thinking through respondents' welfare, robustness and impact throughout this training course. So here is our example, going back to Deviland. Do we need to collect data in the first place, was the question that we were told to ask ourselves. Well, we've identified our research aim, and our research questions here are all around whether or not persons with learning disabilities in Deviland have fair and equal access to local healthcare facilities, and if they don't, what are the barriers that they face? So that's what we've identified as our research questions. And the question is there good enough data to answer those questions already? And we found out there wasn't, and therefore there is a need to collect new data, because data on this particular group of individuals has not been systematically collected, and neither has it been collected using tools that are appropriate for the needs of persons with learning disabilities. So this project can fill that gap, both in terms of the data itself, but also in the methodology that is really appropriate to understanding the needs of this group. Further, we identified that our audience, yes indeed, are likely to be influenced by high quality data, so we should go ahead and commission this research and go out and get it. Okay, so now we know we're going to go and collect some new data. What is the legal and regulatory context that we're working in? So a really important question to ask yourselves is, do you have the permission to conduct this research? If you don't, not only may you be operating outside of the law, and this may get you in trouble, but it means that your data will have been for nothing. All this data collection work, even if you've got the highest quality data in the world, if you didn't have the legal status to collect that data, then you can't use it. So it's really important to understand this context and what might be some of the legislation, some of the context that's legal that might apply to you. Now, in Nepal, for example, we know that you need permission to go out and get the data as a researcher from a non-profit organisation from the Social Welfare Council. So you've got to get that permission and go ahead and get that before you start your research. What are the other legal requirements for collection, storage and processing of data that you need to adhere to? Well, in Vietnam, we know that there are several different pieces of legislation that will apply to you and your work on data and data about people. There is the APEC privacy framework, so it's not just national data you've got to look at, but also regional data. The ASEAN framework on personal data protection also has important policies in there in terms of how you should be handling personal data. There's the cybersecurity law of 2022, a new one that's just come into play, as well as the older law on protection of consumer rights, which is being updated at the moment. Plus a draft decree on personal data protection. So there's new legislation coming out all the time that involves data, personal data in particular, and how it can be used. So make sure you're aware of those legal requirements in the context in which you're working. Finally, it's also important to consider the legal status of particular left behind groups. So when you're capturing data and you're asking for particular identifiers and people to identify themselves as having particular characteristics, it may be that there's a legal context to that very identification. As an example, in Bangladesh, they criminalised same-sex sexual behaviours between men. So it may be actually putting people at risk, and it may be a dangerous thing to do to have certain identifiers on your survey and that you're collecting data about. Now, what rules and standards should be followed in order for data to be officially recognised? This is different from my previous slide. My previous slide was looking at the legal regulations, what you must do in law to stay the right side of the law. This is looking at what you should be following, standards and procedures that enable your data to be taken more seriously and to receive almost like certification by particular authorities, which enable it to be kind of more useful and taken more seriously. There's a very explicit and helpful example now in Kenya. So in Kenya, the Kenyan National Bureau of Statistics has just issued some guidance in 2022 for civil society organisations to show them how to collect data that enables that data to be considered as part of Kenya's official reporting on the Sustainable Development Goals. So some of this criteria includes providing sufficient transparency and clarity on what your data is, that you've got the metadata and the codebook all available, and we will discuss what metadata and codebook is later in the course. It looks for credibility and trust to be there, not just in the data, but in the organization itself that's collecting the data. And finally, it's asking that the data fills a required data gap. So it's filling a need, particularly in the context of SDG data. So have a look around. What are the standards and regulations and rules that can be followed to give your data extra credibility and extra usefulness if you adhere to those rules and guidance? So back to Deviland. Do we have the necessary permissions to go out and collect data? Well, yes. In Deviland, we went to the Civil Society Organisation office and got access granted to conduct this research. Voluntarily, we also reached out to the Ministry of Health to make them aware that we're asking questions about healthcare facilities. This was voluntary. We're not doing this because of rules and laws and standards, but we're doing this to already warm up our audience as to the kind of data that we're going to be collecting. And that's why this bit is in green, because here we're thinking about quality in terms of impact. So what part of the preparation process can help us to achieve the impact? Well, it's voluntarily reaching out at the very inception stage of the research to speak to our intended audience. When it comes to what we have to do, there is already some draft data protection legislation for Deviland. Now, it's not in law yet, so we don't actually have to adhere to it yet. But we think if we do, and we've read through the draft legislation and it looks good, so we think let's stick to that. Let's adhere to this draft legislation. If it comes into play later on, then we're on the right side of history. And it's likely to improve our uptake. It's likely to improve how this data is then perceived. But not only that, we said it looked good, right? This is good legislation that is likely to protect the privacy of vulnerable people. So it's a good piece of legislation that we do want to follow if we're going to protect our participants, our research participants, from harm. Okay, so we've done what we had to do in law, and we're looking at the regulatory procedures that have been set out by the countries and the states that we're operating in. But this section is about research ethics. This is about what we should be doing and what's within our control to determine what is good and bad practice. So for a start, we should put in place a good quality ethical review process. So what does an ethical review process look like? Well, it will go through the whole of the research cycle, the whole of the data life cycle that I was talking about earlier, and look at all the potential risks that may be imposed, particularly to persons that are vulnerable and the people that are in the study and that we're collecting data on. Now, in academia, you have research proposals that have to go through particular ethical committees within the research institution, within the universities. We don't have that in the civil society sector. We don't have those big institutional bodies like universities do, but it's important that you set up your own process, and ideally that the approval of the ethics process and of the ethical review you're doing includes the voice of the marginalized groups that you're collecting data from, so that you know when you've thought through all the different ethical issues, you're considering it from their perspective as well. So ethical consideration is required on the research participants, as well as covering issues of research misconduct. Now, we're going to assume no one is going to deliberately go out there and intentionally falsify data or manipulate analysis, so we're not going to be covering that. But ethical consideration is also important when you think about how you communicate your results and whether you're being true to what the data is actually telling you. The communication of results and the ethics entangled with that, we'll cover in Module 3. Here, we're just going to talk about the kind of ethical issues you want to consider through the data collection, storage and management process. So first up, we're going to talk about voluntary participation. This is a really important element of data collection. Essentially, what it means is that everybody who is answering your survey, who's participating in a focus group, discussion or an interview, has chosen to do so voluntarily. They're under no duress, they're not under any obligation to participate in your study. Now, it's important to take special consideration when you're working with people that are already vulnerable and already marginalized, that may feel very difficult about saying no to participation and may feel very awkward or obliged because of perhaps who you are versus who they are and the context and environment in which you're collecting this data. So it's really important to let people know who you are when you're going to ask them to participate, and make it very clear about how they can opt out, and that they can indeed opt out from the study with no negative repercussions. Another really important issue to address is informed consent. So not only are people actively choosing and volunteering to participate in your study, they know exactly what they are participating in. They are informed. So this consent to participate, this agreement that they're going to be a part of your study, is fully informed by a good understanding of what this study is all about and indeed where the data is going to go. You can provide participants with an information sheet that contains all this information about what the study is about, but it's, again, for vulnerable, marginalized, excluded people with particular needs. It's really important that you think about those needs and whether or not people are understanding and truly being informed about the study itself. So you may not, it may not be sufficient to provide a text that is for somebody to read to understand, the information around the study. You may need something verbal. You may need to describe to them how the data is going to be used. Use examples, use names, and be much more specific. A particular group that you might be collecting data on is children. And their informed consent is a little bit more tricky. You may need to get informed consent by a parent or guardian, but that may again be a really difficult and tricky thing to do if you are asking questions to that child about their parent or guardian, and it may not be appropriate that that is the person that gives consent. So lots of different consent issues that you may need to address depending on who your target group is for the study. Another important element, ethical element to address, is anonymity. Make sure that you can tell your participants that they won't be identified through this study. A key way to do this is don't collect any data in the first place which can identify that person. So don't collect people's names or too much information about their telephone number, photographs of them, anything that can help identify that individual. It's also worth recognizing that even if you don't have those individual identifiers, you could still identify a particular population group, a community, just by virtue of them being small and very distinct in a population. And that may also be problematic if a group feels that they can be identified as participants in the study. We will talk in Module 2 about anonymization and pseudonymization in more detail. If you have collected data that you feel does identify participants, likely this is because this was necessary in order to go into the field and know who you're asking the questions of, that you've had to collect this kind of data. But there in Module 2, we'll talk through ways of anonymizing that data so that individuals are no longer identifiable. So making sure that anonymity is present is really important when it comes to your ethics and your research ethics for the study. Confidentiality. Store things securely. This shouldn't be, the personal data is not publicly available data. The publicly available stuff are your findings that synthesize and analyze a collection of different results from a number of different people. What is not public information and which should be confidential is anything about people and individuals. Making sure you're following data privacy protocols that protect that confidentiality is really important. Now, oftentimes you can't guarantee confidentiality 100%. So let's say, for example, you're running a focus group discussion. You have half a dozen people in the room talking about various issues. You cannot guarantee that one of those 6 people doesn't go outside the room and talk about what another participant in the group says. You can ask them not to, and for sure, part of your ethics is doing everything in your power to make it clear to participants that nothing should be shared outside of this room, but it's impossible to control what everyone is doing outside of your sphere of influence once they step outside the room. The important thing from an ethical process is to do whatever you can do to manage and mitigate the challenges of and the risks of information being shared. Finally, this is all about doing no harm and safeguarding the interests of vulnerable people in particular. And safeguarding is all about promoting people's welfare and protecting them from harm, abuse, or neglect. And it's critical that you recognise that within the data collection process itself, there are real harms that can happen to people. Psychological harms, where sensitive questions trigger negative emotional reactions, shame, anxiety, questioning themselves can be really difficult for people. Social harm can be inflicted. Participation in your research can carry social risks where people notice that others have been participating in a study about certain questions. Physical harm, pain, injury can come from study procedures. It's not unheard of that as part of the participation process, it's difficult for people, particularly with physical disabilities. And legal harm, reporting sensitive data, if you're asking people questions about things that have legal issues attached to them, you're asking people to, confess to themselves or someone else doing something that's illegal, can lead to legal issues and a breach of privacy. So be very aware that throughout your data collection process, there are real harms that need to be taken into consideration and managed and mitigated through your ethical review process. How do you do this? Safeguarding assessments. So consider systematically things like financial costs, physical barriers, or the stigma that may be incurred as a result of participating in your study. And also be prepared to signpost and share information about services, support services that may be relevant to the individuals that are participating in your study. So where certain triggers occur, for example, reference that person on to a service that can help them. Back to Deviland. What did we do for our study? We were working with a group of individuals that have learning disabilities. So we developed our own ethics review process and reviewed it with persons with learning disabilities to make sure we were taking into account all the various risks that may be incurred by people. We then trained our enumerators. We worked with them to understand when and how to direct survey participants to certain support services for people with learning disabilities where their issues may come up as part of the research process. We viewed all the information, consent forms and questionnaires to check they were appropriate and understandable for different people with different learning disabilities. And then we explored alternative methods of consent, including whether or not we could ask guardians or carers for people with the most severe disabilities to provide consent on their behalf and help with the translation and interpretation of all the materials and what indeed consent actually meant.
All right, so we have prepared for data collection. We have made sure that we have met all the legal requirements necessary to collect data on people, and we've also, considered all the ethical issues in research. And now we need to go ahead and collect data. So the first thing we need to ask ourselves is, what's the scientific issue that we want to address? So that is coming up with a research aim. What do you really want to find out? And that is also supported by the research questions. Ask yourself precisely, what do you want to find out? So for instance, you just want to find out the proportion of people with learning difficulties in Babyland. So that means you don't have pre-existing information about the extent to which people have difficulties in accessing maybe learning services. And after you've developed a research aim, you need to ask yourself, which type of data is most relevant for this study? Is it quantitative in nature? That is, does it involve tables, graphs? Do I need to produce hard numbers based on this data? Based on this question, does this research objective require hard numbers? How do I need to present my results? Do I need to present them in form of tables or figures or just some statistics? So that would mean, if that's the nature of your research, then you'll need to collect data in form of numbers and figures, which we call quantitative data. Alternatively, you may develop a research, you may want to answer the research aim that just involves wanting to know people's experiences about a particular problem, and that would mean you need to engage in an in-depth discussion with them just to get their insights, get their opinion, and you're going to engage them in a conversation. So you'll be asking them, for instance, why do you think that most people in Deviland, for instance, don't have equal access to learning services? And then they'll tell you, I think we have limited access because we don't have the necessary support, for instance. So if you are collecting data on quantitative, that is quantitative in nature, then you're going to produce those results in form of graphs. For instance, in this case, we have a bar graph. So that would be for an example of people's experiences or the proportion of people with learning difficulties in Deviland by age cohort. So you may have the age brackets, and the height of the bar graph tells you the extent or the proportion of people. So the taller the graph, the higher the proportion of people with the characteristic that you're studying. If you're collecting data that is quantitative in nature, we've said that this deals with questions that are related to, wanting to know more. You're probing more on people's experiences. So you ask them because, and they give you an answer. We think that we have limited access because you do not have the necessary support services. Or in some cases, you may have to conduct research that requires both types of data, so both quantitative and qualitative, and that means you're going to produce both, the numbers and then supporting the reason why we're seeing those numbers, so giving a justification. So that is a mixed methods approach where you have both qualitative and quantitative data. In terms of methodology, how do we collect quantitative data? Normally, we could use the randomized controlled trial. So this is where you have a baseline survey, then you're proposing some intervention. Once you introduce that intervention, then you observe the behaviors or the outcomes after the post-intervention, and then you're able to tell whether that intervention is effective or not. Or for the qualitative data, you engage in intellectual discussions and just wanting to get insights from people about the experiences about a particular scenario. In the quantitative nature or in the mixed methods approach, you may need to collect data using surveys. So surveys, there are methods of collecting data using surveys. One is using questionnaires and interviews. So having your questions sent to your respondents, they respond to them. But then you can also collect that information from secondary data. So these are pre-existing information which you can analyze and retrieve from those sources. Okay, so we are going to consider the various tools of collecting data that you want to gather from your respondents. And one way is to use surveys. So surveys is a popular way of collecting data. But then there are also different tools, there are different tools under surveys which you can use to collect information depending on the practicality of using the tool, the cost implication, reliability, and validity. So we are going to consider various modes under surveys. We can have face-to-face interviews where you visit respondents and ask questions and they respond and you record. Or you could also send questions by mail, so mail outs. The respondents receive the questions and then respond. Then they mail you back the questions. You can also have phone interviews where you don't need to be physically present at the location of your respondents, but instead you can conduct the interviews and ask questions via phone call. An example, so online surveys is a popular way that people have adopted in gathering information based on its desired characteristics or the convenience it brings. First is that you just capture data in digital form, and that reduces the risks of losing data and transcription errors. And it's also a quick way to access large sample without constraints of time and location. And data is also easy to process and analyze because once you have collected data from the online platform, you're able to compute quick statistics just to check on how the quality of information you have. However, you may exclude marginalized groups without internet connectivity. Remember these online surveys. So if your primary focus is to reach out to the marginalized group who are vulnerable, then online survey may not be ideal. And again, anonymity and accessibility is also encouraged. And people just respond; they do not reveal the information. So they find it easy to respond to the questions that you're asking because you're not asking them to identify themselves. So anonymity and anonymity is guaranteed and it's easy accessibility. Let us now consider questionnaire as a way of gathering information or data extraction tool. How do we construct the questionnaire? Which type of questions do we include? And how do we guard against putting the respondents in danger, either legally, ethically, physically, those forms of injuries that respondents may be exposed to while you're collecting data. So while we want to minimize the extent to which we collect personal information from people, we also would want to have sufficient information that helps us understand what their differences are in terms of their experiences. And this we can only do once we understand their characteristics. So in asking who is left furthest behind, we want to ask who are they in terms of age, gender, their geographical location, their disability status, are they persons with disabilities or not? What is their ethnic orientation, or anything that could help us identify these individuals. But however, while we also collect such extensive information, we also want to consider the legal requirements. For instance, you can't ask questions about religion or religious affiliation in France. Also, in some countries, you can also not ask people, you cannot collect information on people with same-sex relationship because it's illegal. In Kenya, for instance, while ethnicity can be asked in any surveys, it is usually a sensitive issue. So we need to take into account which questions we're putting into the questionnaire and how we ask those questions. So there are forms of survey questionnaires. You have open-ended questions and closed-ended questions. So in closed-ended questions, they're usually best for quantitative research, where you give people options from which they can choose, and you do not give them the leeway to just answer the questions in an open way. So you provide numerical data that can easily be analyzed statistically, and you can easily see the patterns, trends, correlations, or make comparison between groups when you use closed-ended questionnaires. So one of examples include questions that are binary in nature. So these are either yes or no questions, agree or disagree questions. So you only have two options there, so you can't choose any other options other than those two. You can also have questions that you can answer in Likert scale, and that ranges from, there is a scale of range. So let's say 1, strongly disagree, 2, agree, 3, disagree completely, or any other range of options. So you normally have a Likert scale with the lower numerical values indicating lower scores and higher numerical values indicating higher scores in most cases. You can also have list of possible questions with only one single answer, like what's your age, so that people can only give numerical values. Or what's your age category? Do you fall between 20 to 30, 40 to 50, 60 to 70? Or you can ask them to indicate the age category or leisure interests. What do you like doing? Then you can give them a range of options from which they choose from. Modes of transport: do you use bus or public means? Do you drive? Do you use train, bicycle, motorcycle? So you give your respondents the choices from which they can respond. And that it's important to ensure that even as you restrict your respondents to closed-ended questions, you cover all the possibilities, and also include options that if the options you've included do not exist in their choices, then ask them to choose any other field. Yeah, so closed-ended questionnaires are important because they help you generate hard statistics really quick, and you can get some particular patterns, trends really quickly from the closed-ended questionnaires. In open-ended questionnaires, the respondents do not have a list of options from which to choose, but they can answer in their own words, conveying their feelings, emotions, and behaviors. So you can capture that because you are engaging in an in-depth conversation with them. They give detailed explanations, and you can get detailed responses from having an in-depth conversation with them. It's normally used for data collection in form of interviews, but you can also use open-ended questions in questionnaires. The impact is that open-ended questionnaires provides a narrative explanation for why things are seen as they are. So we do not only see any trends, but they give information on why we are seeing such trends and patterns, and therefore that means they provide some causal insight. We say that, for example, people are poor in this region because of 1, 2, 3, or I do not attend school because of my disability status, since I do not have enough support or something. So you get additional information, additional explanation to the responses that they give, and that can be used for causal inference or to derive implications for policy and practice. And the beauty is also that they tell human stories and make the data emotive, so you're able to see how people respond. You're able to capture their emotions and behavior, and that tells a story beyond which over and above what quantitative data can provide. When you are constructing questionnaires, you need to consider a number of things. One is the content of questions. how are you asking the questions? All questions should be narrowly focused with enough context for the respondents to understand and answer more accurately. So avoid questions that are not directly relevant to the survey's purpose and include aspects, for instance, of aspects of poverty and inequality that matter to people themselves. If you're collecting data on people with disabilities, for example, then only include questions that matter to persons with disability. So the content of questions matter. Only include relevant questions. Another consideration is the phrasing of questions. How are they phrased? How are you asking the questions? So the survey questions should be as clear as possible and very precise. So when you're constructing the questionnaires, tailor your questions to your target population, keeping in mind the level of knowledge of the topic and any cultural sensitivities or stigma in particular topics. Like we mentioned, if you are asking questions on persons with disabilities, you can't just ask them, are you disabled or not? That might be offensive to your target audience, target population, and therefore look for a nicer way of framing that, a way that does not sound discriminatory and does not sound offensive. You could ask, for instance, like the Washington group of questions on disabilities, asked on for persons with disabilities as, do you have any difficulties in doing activities including seeing, hearing, doing physical activity, taking care of yourself, remembering or anything. So make them as accommodative as possible. Also use a language that respondents will easily understand and avoid words with vague or ambiguous meanings. Make sure the questions are phrased neutrally with no bias towards one answer or another. So let your respondents choose to answer correctly. Do not ask clinical questions that are leading to what you want them to, how you want them to answer the questions, but let them answer the questions willingly without being persuaded to answer in a particular way. Also, harmonize the questions with the existing data to enable accurate comparisons. The main reason you're collecting new information is that you want to fill some gap in the existing data or evidence, and therefore link the questions with the existing data so that once you collect new information, you're able to see the improvements that you have made. You should also consider the ordering and the layout. Start with the questions that are non-sensitive, questions that are easy to respond to. Then go to questions that require more detail and requires the respondent to think, and it may not be very, very easy for them to answer in terms of how they feel about the questions. So that's important also to consider. So this is an example from our hypothetical example, Davyland. So the Davyland survey is for persons with learning disabilities. We have adopted the mixed methods, that is both collecting both qualitative and quantitative survey of questions. And we're using face-to-face interviews to aid interpretations of the questions, but data is entered by the interviewer directly to the online tool. And then we have a short questionnaire, including questions that allow disaggregation of our analysis. So we have questions on sex, gender, age, ethnicity, and income. And we have visual representations of scale and answer options that we have provided to our respondents to guide the responses. We now want to consider how we choose our sample, the people from whom we are collecting information. And so we begin with the concept of population and a sample itself. And why do we do sampling? We can't survey the whole population. So sometimes for organizations that are just collecting information to inform policy in some particular sector or for some particular set of people, it's important to just select a section of the population and gather information from them. So it is practical to do so. And again, data collection is very expensive, so it's cost effective to do a sample. So the population is the group that you want to draw conclusions about. So you're not entirely collecting information from each of them, otherwise that would be a census. But once you've collected information from a section of the population, you want to generalize your findings on this population. So the population is the group that we want to draw conclusions about. And this can be defined, by a national population, or a subset could be a group of people defined by geographical location, maybe by province, or by age category, or by income group, or many other characteristics that could that you'd want to draw conclusions about. And in most cases, that specific population may be excluded from the broader studies, and that's why you want to customize sample, or to study specifically that set of people who you think that sometimes policy tends to leave out. How about a sample? You can see so many people there, and from the sample is just a selection of a small group from the entire population. So the sample is the individuals that you will collect data from. These are the people you will actually survey. You will talk to them and get information from them. Now the size of the sample is always less than the total population size. Of course, because we're drawing the sample from the population, and it is normally randomly selected and representative. That means that whatever information we get from the sample can be generalized at the population level. And so this allows us to make those generalizations. However, in most cases, when you randomly select a sample, you risk losing or excluding vulnerable groups or small populations because there are not so many. So when you draw a random sample from the population, you are likely to pick people who do not belong to that category. And so randomly selecting these people, randomly selecting a sample could exclude that set of population in which you are interested to draw findings from. So still on sampling, let us consider some related concepts, and we begin with the sampling frame. So a sampling frame is simply a list of individuals from which you select people to collect data from. So this list ideally should include every member of the population, but sometimes this is not possible, and it may be difficult to obtain for especially vulnerable, small, excluded populations. How about the sample size? So this is just the number of people you will interview or you will collect data from. And this number of people depends on a number of factors, including the size of the population, whether the population is small or large, the variability of the population, that is whether it's homogeneous or heterogeneous, and the subgroup analysis you want to do to understand the difference between people within your sample, and also your research design. And there are different ways of calculating the sample size depending on what you want to achieve. So ideally, the sample size n ranges from very low, and that gives you low certainty of your results and low power, to very high, or includes very big number of people, and that gives you high certainty and high power. So ideally, your sample size should range between those bounds. So like we said, there exists a number of formulas which we can use to calculate the sample size. And number one is the basic solvents formula, which is given by, which is expressed as you can see, small n equal to capital N over 1 plus capital N E times E raised to power 2. So let's unpack the components of this equation. The small n is the sample size, which we want to find out. The big N is the population size, and that E is the margin of error. So if you know the population size and the margin of error, then you can easily crack that to give you the sample size. So from the solvents equation, let's consider two examples. Number one is the sample size calculator here. We have the confidence interval of 90%. We know the population size as 900,000, and the margin of error we are allowing is 5%. So given these components, all we need to know is the population size, which is n, and the margin of error, which is e. When you apply the solvents formula, you will find that the ideal sample size you want to draw from a population of 900,000 with 5% margin of error would be 271. Another example on the right is what we have here. The confidence interval is 95%. The population size is 1.8 million. The margin of error is 2%. And going by solvents formula, the ideal sample size will be 2,398 people. But even as we do sampling, how do we do the sampling? So let's consider the sampling methodologies. Broadly, there are two types of sampling methodologies. So we have the probability sampling methods and the non-probability sampling methods. So in probability sampling methods, under probability sampling, every member of the population has a chance of being selected for the study through random selection. So you don't have any bias. You could close your eyes and draw anyone from the population because everyone has an equal chance of being selected. So you could do that by generating random numbers, or you could select individuals at regular intervals. You could do stratified, so you classify individuals into subgroups with homogeneous characteristics, or you could also do cluster sampling. So those are the four approaches to probability sampling methodologies. We have the random sampling and the simple random sampling, and number two, we have stratified sampling. There's cluster sampling. So those are the key methods of drawing samples using probability sampling. In non-probability sampling, however, individuals are selected based on non-random criteria, and not every individual has a chance of being included. So this could include convenience sampling, where you choose individuals because they're conveniently accessible. You could have voluntary response, so people willing to respond, you identify them and you interview them. Purposive or snowball sampling. So snowball sampling is for instance, if you are doing a study on commercial sex activity, those that there are very few people in the population who you could identify of that type, and therefore if you find one of them, they could lead you to getting the other people who are like them, and then you could go ahead and interview them. So those are the two broad categories of sampling methodologies: probability and non-probability. Under probability sampling, we have simple random, stratified, cluster sampling, and then in non-probability, it's convenience, purposive sampling, voluntary response, and snowball sampling. You could see in the simple random sampling, in this case, everyone could choose anyone from the peanuts there, assuming that our sample is peanuts. So you could select anyone there, but you can see in non-probability sampling, it is sort of already clustered in some ways. So you could choose the white groundnuts, the brown groundnuts, or any other people with homogeneous characteristics within the same group. So that is the main difference. So in our Dairyland example, when we are surveying persons with learning disabilities, we are going to use non-probability sampling with maximum variation purposive sampling. So under the sample, what we want to target certain voices that are more excluded and reluctant individuals and groups, and therefore we are collecting data from a range of geographical locations, persons with learning disabilities, with quotas for age and gender. So we are considering people's gender. We ideally want to draw persons from all genders and persons from all ages in given locations, and so that we have the maximum representation from that purposive. So we are not randomly selecting, we are very purposive in our selection, such that the final sample is representative in terms of gender, in terms of age, in terms of geographical location. And that will give us a more representative voices from the sample. Our sampling frame, we are using education people because we are sampling people with learning disabilities. So we are looking at the list from education, list from health, and other disability support institutions who have a register of persons in the institutions. Our size, the sample size we're targeting is 271 because our population is 900,000. The confidence interval is a 95% confidence interval, and the margin of error, we also know that. So based on the solvents formula, our ideal sample size is 271. We have now developed the survey instrument. We have chosen the sampling methodology. We have our sample. We know the sample size. And now we want to consider what do we need to do while we are in the field doing the actual data collection. What controls do we need to put in place such that the data we get is not too dirty? We'll do this more in Module 2, but it's important to develop your survey instrument with validation controls in place to help you reduce the errors. So one of the things you could do is to require that answers to every question must be answered before you move on to the next question, so that you avoid missing variables or missing observations. And this could also include giving people the option to choose no answer or prefer to not answer if they're not comfortable answering. You also need to define if answers should be numerical or in text. You also need to decide whether to allow one or more answers in multiple questions. So these are just some of the controls you put in place so that you have clean data that is easy to deal with, that you can quickly analyze to give you, headline statistics. Identify contingent questions. For example, if someone answers yes in a particular question, if that is a requirement for them to answer the next question, then only people who answered yes in that question would be allowed to answer the question that follows that same logic. So identify the contingent questions in this nature. Still on quality control, what else do we need to do? Pilot your survey instrument so that you know how the questions will be answered. Are the questions understood, how they are intended to be understood? And do people feel comfortable answering those questions honestly? You need to pretest this before you do the actual data collection. And you also need to provide enumerator training. Train the enumerators or the data collectors or the research assistants on how they're going to use this instrument, that they should abide by the code of conduct and the ethical considerations while doing the actual data collection, so that they are able to manage particular risks and sensitivities of the groups that they are being surveyed. Remember, we're dealing with vulnerable categories, and therefore your research assistants or the field enumerators need to be aware of the sensitivities of these vulnerable categories. You also need to apply mitigations identified to address the ethical and safeguarding risks, including and obtaining fully informed consent. So obtain the consent of your participants before you do the actual data collection, so that they know what they're signing up to, and that tell them that this is voluntary participation. They're able to withdraw from the participation at any stage during the data collection, during interview. And then be prepared to terminate fieldwork. That's what I've said before. based on the ethical and safeguarding risks. So if your respondents do not feel comfortable to answer questions anymore because of the sensitivities that are involved, then be prepared to terminate that study. The safety of respondents is more important than your research or research findings you want to come up with. And then record and encode, transcribe your data immediately. This helps you to deal with any errors just after the fieldwork. So double check the manual entry for the errors so that all the sections and all the responses are valid. And this is important for quantitative data so that as you move on to analysis, you're able to work with the data set that is clean, that is valid, that is complete. And it's also important to, once you go to the field, record the responses immediately. That offers security to the data. Remember, you're collecting sensitive information about people. Once you record and de-identify the data immediately, then at least the safety of your respondents is guaranteed. So back to our example in Deviland, survey for persons with learning disabilities. What have we done in terms of sampling? We have done in-depth training of enumerators on the types of learning disabilities that the respondents may have and how to support respondents through the interview. So in case of some sensitivities, we have shown them how to ask the questions in a way that is not discriminatory, in a way that does not evoke emotions, and how to manage the sensitivities during the interview. We have also piloted the tool, the questionnaire, so that we know what is the range of values we are expecting, how are the questions needed to be answered, and how much time is needed for the survey, so that we have a sense of how the actual data collection will take place. And how are we collecting the data? The data is going to be collected using digital tools, so we are going to record everything in real time with no transcription of error risks. So once the field workers are in the field doing data collection, we are able to monitor the responses they're giving, and we're able to correct any errors that are arising from the field in real time. So this allows us to control the actual data collection. So in summary, what have we done in this module for data collection? That is module 1. We have looked at the rationale for new data collection. We have justified why we need to collect new data, and we have ascertained that new data collection is necessary. Number 2, we've also considered the legal and regulatory context of our study. So we've looked at all the legal and necessary regulation framework and ensured that we have adhered to everything. And number 3, we've also talked about research ethics, so ethical considerations during data collection, making sure that we have mitigated all the risks during the data collection, especially that we may expose our respondents to. We have also talked through coming up with research design. What is the question we want to address? How do we want to address it? What type of data do we need to collect? How are we collecting that data? And how do we even construct that data collection tool? So we talked about questionnaire, both open-ended and closed-ended. We've also talked about how to arrive at the sample. So sampling frame, the population, the sample size, how we calculate the sample size, and the factors that determine the size of our sample in our study. Finally, during data collection, the actual fieldwork, what mitigation do we need to put in place to safeguard the interest of our respondents? And we've talked about all the necessary things to consider, coming up with clean data, piloting our instrument, training our enumerators, going with them through the questions so that they know actually how the questions will be asked and how they manage the response, how individuals respond, and how to make the necessary adjustments so that people feel comfortable answering the questions and that the questions are answered in a way that we expect respondents to understand them. And this is the end of Module 1. It was nice taking you through this. Look forward to meeting you in Module 2.